Hello, my name is Suzanne Aziz. I'm a clinical psychologist, normally work at the Glasgow Psychological Trauma Service and have been working in specialist trauma services for many years. And I am the TPTIC, Transforming Psychological Trauma Implementation Coordinator for Greater Glasgow and Clyde. And I've been asked today to come along and speak to you about the Glasgow City journey on trauma-informed systems, services and workforce, and Glasgow has been on that journey for some time as one of the initial pilot sites. So I thought it might be helpful to start with thinking about the network of support that we have in Glasgow, and I'm sure it goes without saying that obviously to achieve the ambitions of this programme of work, it's not really possible without a whole group of people involved and collaborating and leading on some of this work together. And in Glasgow, I think we have a very kind of cohesive collective group, and we come together with the trauma champions and trauma lead officers regularly. So I meet with the lead officers on a monthly basis and the trauma champions 8 weekly with the lead officers too. And together we have, I guess, an opportunity for support, collaborating, thinking about initiatives across GG&C, which some we have been able to take forward together, and working through some of the challenges that we might be all experiencing, and I guess feeding back up into our national partners. And in each local area, obviously we have our own networks of support that we're able to link in with. So collectively, I think that has enabled us to really make some good progress across GG&C. So just to give you a bit of a sense of the Glasgow City journey so far, and Glasgow has been on this journey for some time, which has been a key enabler in being able to progress the work and get us to where we are today. So the journey for Glasgow City started back in 2017, with an initial training needs analysis. And that was conducted at the time to inform, to provide the information, to put forward a bid to become one of the initial pilot sites for the implementation of the National Trauma Training Programme. So that really helped to identify where the needs might be and to kind of identify some priority areas that they wanted to focus on as part of that pilot. And Glasgow City was awarded that. And from there, a steering group and an implementation group was established to think about what it might look like around implementation for Glasgow City. And so 4 service areas were selected because of high prevalence of trauma and the recognition of needing to upskill the workforce within that area. Initially, there was an ambition to do that citywide, so across the 4 adult services that were selected, which were homelessness, ADRS, mental health and justice. But because of the scale of it in Glasgow City, they decided to focus on one locality, which was the northeast area, due to some of the additional vulnerabilities in that local area. So a plan was put together and there was a launch event planned for 2020, and unfortunately COVID hit at that time, which had a significant impact on the ability to implement that delivery plan. And at that time, there was a real recognition that we wanted to do something that would be feasible, given some of the restrictions around COVID for training delivery, and also some of the pressures and tensions for services in terms of being able to release staff for training, and really the recognition of the workforce wellbeing considerations at that time. And we knew already from lots of the evidence internationally and nationally around what was required to kind of really provide that infrastructure to support kind of sustainable change over time and to think about a culture shift. So a decision was made to propose a leadership training programme, and that would be the focus of the pilot site. And so that was taken to the senior management team in 2021 and agreed, and there was a clear commitment from strategic level managers to progress a leadership training programme for those 4 adult services. And that really took us on to 2023, and we managed to put through the 4 adult services leadership group through a leadership training programme, starting with the executive group initially, and making some clear commitments within that, which have then supported embedding that within the HSCP strategic plan. And I guess because of that journey and because of the opportunities for, creating some of that scaffolding, we've been able to build on that. And this is really where we're at just now in terms of the current infrastructure for Glasgow City. And I think there has been lots of learning along the way on that journey, and helping us to understand what's really essential in terms of ensuring kind of sustainability of this programme of work. So there's a real commitment from senior level management at the executive group, which has been clearly communicated now within the HSCP strategic plan. So we have a really helpful infrastructure of support to enable this programme of work to happen. So I'm not going to go through all of that, but this is our governance structure essentially, and you'll see that in the middle of that we have our steering group. So this was building on the existing steering group from the pilot phase, and was reconfigured in March 2023 to represent the wider city rollout. And in Glasgow, there has been a commitment to delivering out a training programme across the HSCP. So the ambition is really about developing a trauma-informed system, workforce and organisation across the whole of the HSCP. And as you can imagine, that's a huge ambition given the scale of it in Glasgow City. And so some of the resource is very much tailored and focused into the HSCP-wide delivery, which can pose some challenges in terms of being able to reach some of our community partners. However, the membership of that steering group does have our key partner agencies involved, and we continue to review and monitor the kind of progress in that and thinking about the membership of that group. And our trauma champion sits within the executive, and again, that has been really instrumental in supporting us to be able to keep the trauma-informed agenda a priority, to have clear commitment, and also to be able to resource. So in Glasgow City, we're in quite a privileged position that they have a dedicated team, and that team is made up of the trauma lead coordinator, 3 senior learning development officers and an admin. So they have a dedicated resource to be able to drive forward some of this change. And the team feed in at all levels. So there is work happening with our executive at the steering group. We have engagement from the team in our expert by experience group and within the operationalising of the implementation groups. So the team are able to kind of dedicate some time and resource to feed in at all various levels, and to be able to drive forward change in terms of building capacity internally. So the team have now progressed some training for trainers and are building kind of internal capacity to support the training delivery at frontline staff level. We have our trauma collaborative, which is our expert by experience group, which was initially formed during the pilot phase. And again, there has been some reconfiguration of that group to think about that citywide rollout. And Resilience Learning Partnership have really supported us to think about meaningful engagement, and ensuring we have a kind of really cohesive, collaborative working relationship. So there has been a number of activities that have been progressed in Glasgow City, which have been supported and co-developed by our expert by experience group. So for example, we're developing a trauma-informed e-module, and that's been through an extensive consultation process and has been co-developed with the collaborative group. And they have really supported us in thinking about some of that language and the nuances that we need to really consider, and the subtleties and how we communicate some of these messaging. And that trauma-informed product will be available to the wider HSCP and some of our kind of partners across GGC. So that's been a really important development and a really lovely kind of development, kind of collaborating on a piece of work and activity together. And there are various other kind of activities that are being progressed in collaboration with our expert by experience group. And at the bottom, we have our implementation groups, which are have either been kind of formed and are well established and are progressing some of that work in their service areas, and others are still kind of being configured and really sort of forming and thinking about their actions going forward. So, for example, the Justice Implementation Group, which is now well progressed in their action planning and being able to progress some of their actions, is formed of leaders from across the city, and we supported that work in nominating and identifying leaders through developing a leadership profile. And so they've been able to identify leaders from across the city, and that group is chaired by a service manager, which then feeds into our steering group and up to the executive. And they have really been able to kind of have clear actions and deliverables and progress through that. So although there was quite a bit of work initially with the justice services, they are now pretty self-sufficient in being able to implement that work. And I guess that's what we would hope to see happening in the other service areas, and certainly with our homelessness colleagues. We're on our way through a leadership programme with them and supporting them to think about how to come to a point of action planning beyond that sort of assessing readiness for change. And similarly with our children's services. So we can see these kind of implementation groups as really essential in being able to operationalise and be able to develop sort of clear actions and monitor that progress over time. And this is just to I guess reinforce that message that the trauma-informed and responsive system is well embedded within the HSCP strategic plan and is communicated in line with a strength-based approach. And that's really the vision for the Glasgow City HSCP and our key partner agencies. So the strategic plan defines some clear commitments for trauma-informed and responsive system through the implementation of STILT for leaders, so it makes a clear commitment to leaders engaging in a training programme and supporting staff through leadership to deliver a trauma-informed approach. It also describes a recognition of the impact of trauma in relation to difficulties accessing services, particularly highlighting trust, and talks about mobilising a culture shift that communicates strength-based, trauma-informed through leadership and staff training. And we're currently working with the HSCP executive group to more clearly kind of demonstrate the progress that's already been made under these priority areas, so these 6 priority areas that they have defined, and then to help identify where some of the gaps might be. And we're using the roadmap as our kind of framework to work with them in terms of assessing the progress that has been made, identifying the gaps and setting some clear deliverables going forward. So just to give you a couple of examples of things that have already been progressed. So for example, under the prevention, early intervention and wellbeing, one of the priority groups that have been identified for training is our Social Care Connect. And that is your first point of contact for social work services. And that group of staff, which is a multidisciplinary group, are also going through a strength-based training programme. So the Maximising Independence and Trauma-Informed programmes are both transformation programmes of change for the city in terms of how we design and deliver services and how we have kind of helpful conversations when people are accessing services. So the idea is to really upskill them and enhance their knowledge and understanding so that they're able to identify individuals' needs and direct them appropriately to relevant services, statutory and within their community. So there's a real emphasis on supporting people within their communities and being able to think about resilience and a more strength-based approach rather than a kind of deficit model. Other things that we're progressing, for example, within health and well-being, the healthy values and supported workforce, we sit on the Health and Wellbeing Committee group, so there's a real clear alignment to some of the initiatives with Health and Wellbeing Committee for the city. The health and wellbeing of the workforce has always been one of the key drivers that leaders have wanted to focus on during their leadership sessions. And we've had opportunities within those leadership sessions to have really kind of open and transparent conversations and really hear some of the feedback from frontline staff around some of their needs around the well-being of and keeping them well at work. And we've been able to provide that information and feed it back into management so that there are some commitments around how to address some of the needs of our workforce. So there's a real kind of clear alignment and a keenness for leaders to keep that a focus as an essential for developing a trauma-informed system. And just to highlight some of the key enablers, and I won't spend too much time on this because I think hopefully it's self-explanatory, but we've obviously learned that from our implementation groups that we do need collective leadership coming together to be able to support this programme of work. So we need those who are at the front line, those who are in kind of in positions where they can operationalise some of this work and they have capacity to do that. But we also really need our more strategic level managers to keep this a priority, to share that vision, but also in terms of resourcing it and authorising some of the changes. So there's a real kind of emphasis on bringing together a collective leadership approach to this work. And I think having dedicated team and an admin has really enabled us to kind of progress that work, keep the momentum, feed in at all different levels, but also to kind of create systems that, more clearly defined data collection systems that are allowing us to kind of report more regularly on the work and the progress of that work. And our trauma-informed collaborative group have been really instrumental in collaborating with us and have really helped us understand the subtleties in communication and the importance of language. And I think the ability to draw on, evidence-based training for training packages from the NTTP programme has kind of reduced some of that burden of spending time on designing and developing training products that are quality issues. So that has been incredibly helpful with some clear guidance that supported us to really progress some of the work at the frontline level for staff, but also at the leadership level. And just finally, some considerations for the future. I think one of the things that certainly I'm finding in Glasgow City is that because of the scale of it for the HSCP workforce, it's really difficult to dedicate kind of time and resource to our key partner agencies. And I think we really need to strengthen the connections with our partners to build capacity across local areas and really achieve the ambitions of the strategic priorities, particularly as they move forward towards a strength-based approach for the city with the emphasis on supporting people in their communities. And there are some challenges in this, particularly in relation to capacity, but also through access to training and implementation support. And I think we need to identify clearer governance routes through the health board to support communicating the vision and strengthening the leadership buy-in at that health board level. And there's something around the mainstreaming of trauma-informed programme of work and this agenda into national policies, plans and strategies that feels really helpful in supporting that ambition of making it everyone's business. But there is a sense that leaders can feel somewhat overwhelmed and can struggle to really navigate their way through that without a defined trauma strategy. And again, there's something about how we communicate more clearly around this, and locally we're trying to make those links with our public health colleagues and to align the trauma-informed agenda to public health messaging, again as an attempt to support having more defined calls of action. And that feels really important in helping to support that message that it is everybody's business. And just finally, to enhance that accountability and be able to evidence change, I feel there is a need to strengthen monitoring and evaluation processes, and having some dedicated time and resource to focus on this can be a challenge, and there is a real need to embed that in existing structures and guidance, and how to do that feels like really an essential component at this stage. And I'm just going to leave it at that, so thank you very much for taking time to listen.